Good morning, Borodar. Lovely to see everybody here. Cabinet Secretary was invited to come. Unfortunately, he couldn't come today, so I have the pleasure of giving you a bit of an update about what's going on in Wales, policy-wise, and some of the latest events that are happening. So I will try and go through them all, and I know we've got a Q&A session at the end, so happy to answer any questions. So there's quite a plethora of things going on in Wales. I would say over the last 3-4 years, we've made a big decision to map out how we can improve things in Wales. I'm going to pick out a couple of them. So probably one of the biggest is Digital Maternity Cymru. I can see some people probably weathered by it already that have implemented and some that are ready to implement. But the idea is by March 26, we will be completely digital with an app as well for women to access their records. So really exciting that we've got to that place. I think there's a few scars on the way, but we're definitely there. One of the other things that we've got is the Anti-Racist Wales Action Plan, which is looking at inequalities in health and maternity care. And it's legislation, so it means that it's something we have to do. And one of the really good things is that we've got maternity mentioned in it, so we have to make sure that we are ensuring equal outcomes for women from all backgrounds. So I'm going to go through some of the other things. Maternity and Neonatal Safety Support Program. You probably all recognise it. It was something that happened a few years ago, where we really did a diagnostic of what was happening that was good, what needed changing, and then we put a plan, a roadmap of how we were going to improve services. So a lot of the things on the first slide are actually in the roadmap. So Digital Maternity Cymru is one of them, perinatal workforce plan, which is really important to make sure we've got the right people in the right jobs in the right places. So we have a roadmap of where we're going. I will talk to you about how we're in the process of assessing that roadmap. So one of the things within the Maternity and Neonatal Safety Support Programme, and it was a lot of discussion we had around the time of doing it, was actually what does good look like? It felt like we were always changing the goalposts of where we needed to be. And we said, you know, we need a consensus of what does good maternity and neonatal care look like? So perinatal care is a real theme across Wales. We've brought the two together. But what does good maternity and neonatal care look like? How do we know that we're achieving it? So what we did, and it's related to the National Clinical Framework, was we actually looked at all of the domains. So you can see the domains down at the bottom. We looked at those domains and said, actually, in maternity and neonatal care, what do those look like? So that quality statement was published the beginning of this year, in February, and that is our goal. That's what we need to achieve. Now, the way that we achieve that is through, and I'm sorry for everybody who's heard this before, so the quality statement to me is the chocolate cake. It's what we're aiming for. So if you're looking in Mary Berry's book, or whoever is the latest, you know what you're aiming for, what it looks like, what it should taste like. And what we need to do is make sure we've got recipes for each part of that quality statement. So those are service specifications, and that's one of the things that we're putting together at the moment with the help of the Maternity and Neonatal Network. So what is expected of health boards? Well, health boards have already looked at the quality statement and mapped themselves against the key aims of the quality statement. We meet with the health boards, and again, there's some few scarred people in the room, every quarter to find out what's happening with those actions. So where are you with Digital Maternity Cymru? Where are you in relation to the perinatal workforce plan? So we look at all those things. So it is sort of performance managed. One of the other things that needs to happen in all health boards is to make sure that we've got Digital Maternity Cymru, but a few other actions as well, which I'm going to go through. So these are the actions for this year. Hopefully you can read them, but I am going to go through each one individually. Now, why did we put those actions together? I think they were levers of things that were going to enable us to do other things in the future. They were also things that were already in train. So what we didn't want to do at any point, and you can see against each of the actions, it's actually linked to the action from MatNeo-SSP. So this wasn't a completely new thing where we said, oh, do you know, we'll do a few more extra things. We actually made sure that they aligned. So this is the delivery process for MatNeo-SSP. MatNeo-SSP has got actions with lots of different people. So my work plan for this year has got MatNeo-SSP actions in it. HEIW, who are our education commissioners, have got actions from it. Health boards have got local actions from it. So everybody is doing individual actions which should all come together to actually provide us with the long-term plan. Those are coordinated through the Maternity and Neonatal Network, and we regularly look at where we are and how much we've achieved and what we need to do next, and prioritise what we need to do next, which is part of one of the exercises going on at the moment. Okay, so one of the key things that we wanted to put in there, and we're really proud in Wales that actually women have got choice of place of birth, but we absolutely recognise that with complexity, etc., staffing, that, you know, some of those choices of place of birth may be, you know, at risk. So actually we wanted it in the quality statement that those choices were still there. So you can see from the map, for anybody who's not in Wales, that actually we have got, you know, some really big cities, but actually we've got a lot of rural areas. So Powys on your right-hand side has not got a DGH at all, so it's not got a hospital, it's got birth centres. So actually it's a completely different model. If you go into West Wales, you know, some of those areas are really rural, and whenever I go down to visit, they always love taking me to the different units and showing me how far apart they are. So, you know, there is a lot of rurality down there. So we want to make sure that those choices still exist, and by putting it in the quality statement, it ensures that everybody is aware of where we need to go. So Digital Maternity Cymru isn't just about having an all-singing, all-dancing digital system. It's the so what. So the so what is that women know what's happening in their care, that their partner's in their care, that they can see what's happened at that appointment, and they're not reading squiggly writing that they can't understand. They've got access to lots of links, that we can do timely referrals, so you can press a button for a referral so that that referral happens. In the long term, what we'd like to see is that turning into then the children's record as well. So it's one of the things that we're working on at the moment with our children's policy team, is to say, actually, how can Digital Maternity Cymru then morph into the next bit? How does it fit with a women's health plan? So actually that your maternity record isn't just something that you put on a shelf and gathers dust, that actually informs the rest of your care, whether you're the woman or the baby. That it gives us data. And we know we've got so much information. You know, they say we're data rich and information poor, and we are, because we've got, we measure everything, but actually, what did it tell us? And that's what we need to look at. So one of the key things that we're doing at the moment is we're looking at what those metrics look like. What do we need to measure? What are those weather vanes that tell us if we've got a good service or not? So those are some really key things that we need to look at and make sure that we're recording it. How often do you hear someone say, oh yeah, we've got our sort of data dashboard of the things that we've got at the moment. Yeah, we'd like to add some more things, but actually these are the things that we've got at the moment. It's about the art of the possible. It's about looking forward and saying, what do we really need to know about to know we've got a good service? And we know how hard it is out there. You know, you've just got to read the media at the moment. And, you know, maternity services and midwifery, you know, we're in a tough place. But actually, I was speaking before we came in, and I said, we've got to measure it in the right way. We've got, yes, there are loud voices that say we may have let down families, but actually, the majority of voices say how amazing midwives are. And we need to remember that actually the majority of service provision is great. But where it's not, how can we put it right? Workforce is really important, and we know with rising complexity, rising section rates, that actually we need to look at the MDT, but midwives will always be midwives, and we've always got a core role in every woman's care. So that foundation of care is always there. What we need to make sure is we've got a good multidisciplinary team that can support us so that midwives can do only what they can do. But actually that we work together. We need to be ready for the future. We need to be talking. I can't believe that, you know, at the Directors of Midwifery meeting this week, we were talking about ambient voice technology and AI. I never thought in my lifetime I was going to be talking about things like that, but we need to be ready. We need to be ready for the things that can assist us in our role, but actually so that we can provide the best care to women, that foundation of care that we're never going to take away. We're always going to be those trusted people that they need. So the All Wales Perinatal Engagement Framework, I was on the workforce plan, but the engagement framework is really important. Women's voices are important, that we know what women are saying. One of the things that we are rolling out in Wales is something called Civica. So we've got perinatal engagement measures that what we found was we were asking women and families what they thought of healthcare, but it was the same questions that you'd get in A&E or an outpatient's appointment. We're not A&E, we're not an outpatient's appointment, we're a 9-month journey that actually has got different twists and turns along the way. So what we've managed to do with the perinatal engagement measures is have different points during pregnancy that we ask women. Because how often do we get to the end and a woman says, I've had a really bad experience, but you might find it snowballed from the booking appointment where something went wrong. So actually, let's disaggregate the information we've got about the journey and find out what went wrong on that journey, because quite often it's not the whole journey that's bad. So let's find out, you know, what was good, what, again, we need to work on. So Civica perinatal engagement measures were piloted in 3 health boards, and we're hoping they'll be in all health boards by October. So that means that every woman has the opportunity at different points in pregnancy and the neonatal period to give her feedback about her care. The other thing that we're doing, and I know England have done this a while ago, is we're ensuring that we've got paid maternity and neonatal voice partnership chairs, because they provide us with their time free of charge. They're amazing people, but actually we need to reward that, and we need to make sure that they can help us hear the voices that we need to hear and put things right, because quite often they've got the ability to tell us what to do. So those are some of the things that are happening with the engagement framework. We will be providing training for the MMVP chairs when they're in post, and CLICE, who are our patient body, will be providing them with the host agency, as we could call it in Wales, a CWTCH. So they're going to be the CWTCH area, so they're going to provide them with support. Okay. One of the other things in the perinatal engagement framework is looking at equality, diversity and inclusion. I've been really lucky to have a midwife in my team for the last couple of years who's been working on some of the elements from the Anti-Racist Wales programme, and I know you're going to hear a little bit more about decolonisation of the curriculum, etc. later on today, so I'm not going to morph into that. But what we need to remember is the intersectionalities. We need to remember that quite often there isn't just one area that may be an inequality, there may be several. And we know this as midwives. We get to know the women. We know what pressures they've got in their lives, but actually it's about seeing that woman as a whole. So I'm not going to go through any more of that because I know I'm going to then morph into somebody else's talk. So the other thing that we are doing, and like I say, we are a perinatal service, is we are now working in partnership. It's being launched in Cardiff on the 29th of September. And we used to have the Bliss Baby Charter in every health board in Wales prior to COVID, but it's sort of dropped off a bit. So what we're doing is working with Bliss, who are really going to support us in family integrated care, in making sure that we've got the best neonatal provision we can have. And we've stolen with pride from Scotland, so we're going to be called Bliss Cymru. Bliss Scotland have already got their own model, so we've definitely stolen it, but really excited about the work that we're going to do going forward. So like I said, the Strategic Perinatal Workforce Plan was put together by our commissioners, HEIW. It's looking at the right workforce for now, but the right workforce for the future as well. We need to get better at planning what our workforce looks like. We have a really close relationship with our education providers in Wales, and that's great. And we've got a streamlining process which enables all student midwives who train in Wales to get jobs in Wales. We are birth rate plus compliant in all of our health boards, so staffing is not an issue, but actually we need to look to the future and say, right, okay, what do we need for the future? What does the age profile look like? I know just after COVID we got hit dramatically because actually a lot of people were retiring. The RCM had told us before in their State of the Nation report. We knew it was coming, but actually we need to get better at workforce planning to make sure that we've got that. We need to look at our MSWs, we need to look at apprenticeship routes and how we can do those, and we're really pushing HEIW on that. The whole MDT, so we need to look at psychologists in neonatal care, AHPs in neonatal care, and in maternity. So all of those areas we need to look at. So the perinatal workforce plan, again, a bit like the quality statement, sets out what good looks like. So the other piece of work that we're doing, that's one of the actions from the quality statement, is the National Bereavement Care Pathways. We're working with SANS, and they're helping with the network to develop 5 pathways, so different pathways across both from miscarriage to child death. They're in England already, but we're making sure that we've got the right training for the rollout, etc. So those pathways are ready for implementation. We've done the consultation on the pathways and they're ready for the implementation phase now. So probably the thing that everybody's like, surely they're doing something else. Yes, we are. So you might be aware that in England are doing a maternity review. Actually, just prior to England announcing their maternity review, we'd already announced, our Cabinet Secretary had announced that we were going to do an assurance assessment. So very different from a review. A review is often a look back. It's looking at cases, it's looking back. Ours is a temperature check in time of all of our health boards, not specific health boards, all of our health boards, to say, where are we? Where are we on that roadmap of MAT-NEO SSP? Where are we in terms of family experience, staff experience, culture, outcomes, all of those things? So the Cabinet Secretary wanted us to do this assurance assessment. It is going to be quick. We are hoping to report by December. The panel is already in place. We had our second meeting with them yesterday. A brilliant panel who are really keen to get out into the health boards and start doing the work. There are different work streams. So the work streams will be, like I say, working with families. So they'll be finding out those families' voices are not just the loudest voices, all voices. Going back to what I said before, right at the very beginning, we know some families have really great experiences. So we need to hear all of the stories. Staff experience, what does it feel like? Is your service well led? Are you supported in your career progression? All of those sorts of things. So staff voices are really important. And staff voices are really important for solutions as well. This is about looking forward to the future. It's about solutions. It's checking our roadmap of Mat Neo SSP and say, is there anything we need to tweak? Do we need to do a little diversion? What does that look like? We're going to look at the data and we're going to look at the evidence. So we're going to look at what we should be doing, and then we're going to look at the data and what that looks like. So we know that things like stillbirth, we've got a real slow improvement on stillbirth, and actually, what can we do to change that? So there are data items that we will be looking at. And then we're going, in the culture bit, we're going to be doing site visits. So you will be seeing panel members in your health boards who will be coming in. They're doing the 15 steps. So they're going to be coming in and just feeling what it's like. Interestingly, I went to A&E with my daughter. She'd had a car accident the other day. And I nearly was, in my head, I was going through the 15 steps. And it's amazing what you see just sat there. And and I'm sure you've all done it. You've all been to appointments and things, and you're looking around and, you're looking at the way you're welcomed. What's the environment look like? One of the things that I noticed was there was a water fountain, and that was great. But actually, there were a load of disposable cups. You were like, have they been used? Haven't they been used? I wasn't sure whether I wanted to go there or not. But it was great that there was a water fountain there. The other thing I noticed was they came out and called people's names, but actually they didn't get the pronunciation right. And I was like, well, actually, in my GP surgery, they do that on like a little written thing that comes up, and it says your name as well. I was like, oh, wouldn't that be better? Because the number of times they came out and never found the person, and you're like, gosh, that's a waste of time as well. So the 15 steps, I think, can be a really useful measure of us knowing. And how many of us know, that thing where you go to labour ward, the woman turns up at labour ward, and there's somebody behind the desk who goes, you brought your notes? And you're just like, yeah, that's probably not the way to welcome people. So it's very much getting a feel of what units feel like. And I know, I go around Wales regularly, and I know that there is some amazing work going on. Some of the awards that we've got in Wales for really inspirational pieces of work is fantastic. And I know the welcome on the wards and the pride that you've got in the work that you're doing is amazing. So actually, I see this assurance assessment, and whether this is, I might stand up here next year and say, oh gosh, I got it wrong. But I see this as a real opportunity to actually check what we're doing and say, do you know, we're doing some fab stuff. Yeah, there's a few bits that we need to change. But actually, we can change things really quickly in Wales. We're a small nation. We work together. We all want the best for the women and families. So I don't see this as a threat. I see this as a piece of work that we need to do. But actually, the opportunities the other side. And that's it. Hopefully, I've not gone over. Thank you very much.